I know when you hear the word root canal, it can sound kind of scary. Well, we're going to bust some of those myths with a great doctor who is also an endodontist. Let's hear what she has to say. A great alternative to getting a tooth pulled is a root canal, and I know that sounds scary, but we've got a fabulous doctor here to give us some more information on why a root canal is better than an extraction. We've got Dr. Natasha M. Flake joining me. Thank you so much for being here.
Thank you for having me, Maddie.
Now let's talk a little bit about why root canals are really a prize factor when it comes to taking care of your teeth.
Yeah, so root canals are a procedure that are designed to save your natural tooth. And sometimes a tooth, the inside of a tooth, might become inflamed or infected and cause a patient pain. And a root canal is a procedure that is designed to save that tooth. By cleaning out the inside of the tooth and then restoring the tooth afterwards, you're able to save your tooth. When at all possible, we want to save our natural teeth. Teeth are so important. They are important for eating, and they are important for speech, for forming our words, and they're also important for aesthetic reasons. Our smile is often the first thing that people notice about us. So when possible, we would like to save our natural tooth because nothing really looks, feels, or functions like a natural tooth.
Now, what are some of the biggest myths around root canals? Because when anyone hears root canal, their first thing is to shudder, but there are some really large myths around it.
Right, yeah. So really the largest myth surrounding root canals is that root canals themselves are painful. And that myth really comes from patients associating the root canal procedure with the pain that they had leading up to that procedure. So oftentimes when patients are in pain, and it may be a lot of pain, and they need a root canal, and sort of they associate the root canal with that pain. But modern root canal therapy is virtually pain-free. So we have techniques, we have anesthetics, we have modern tools and instruments that can help us to perform root canal therapy in a pain-free manner. And an endodontist is a specialist in root canals. So endodontists have 2 to 3 years of additional training after dental school. And that training allows us to be specialists in diagnosing tooth pain and in treating tooth pain and in performing root canal treatments, especially root canal treatments that are more complex.
Well, you just answered my next question for me. So if someone is experiencing tooth pain, what should they do?
If someone's experiencing tooth pain, first of all, it's really important to get it taken care of as soon as possible. You don't really want to wait because the problem can get worse. So you can either go see your general dentist to address that tooth pain, and sometimes your general dentist will refer you to an endodontist. But if you don't have a general dentist or would like to seek care directly from the endodontist, you may do that as well. So endodontists are the specialist in diagnosing and treating tooth pain. And you can find an endodontist in your area by going to findmyendodontist.com.
Now, why is it so important for people to take that first step, maybe leaning towards a root canal over a tooth extraction?
So there are, sometimes extraction is an option, but because our teeth are so important, we really, when possible, like to save our natural teeth. There are options for replacing teeth, and sometimes those are necessary, but when possible, we like to save our natural tooth because the replacement options are never really going to look, feel, or function quite like the natural tooth does. There are logistical reasons as well, because extraction and replacing it through another method also requires additional time and expense. But really, it's that saving the natural tooth and that function that it provides that's so important.
Now, if people are interested in learning more information about endodontists or maybe how they could find one in their area, what's the best resource for them to use?
Right. So if you would like to find out more information about root canal therapy or about endodontists, you can go to AAE.org. And if you would like to find an endodontist in your area, you can go to findmyendodontist.com.
Dr. Flake, thank you so much for taking the time to chat with us, giving us all this great information. Now, what's one tip that you give people to help take care of their teeth to maybe avoid root canals overall?
Really, the first step at avoiding root canal starts at home, and it starts with good oral hygiene, brushing and flossing, And then the next step is really to see your general dentist on a regular basis for preventative care. And that can help you to avoid needing a root canal. And if a problem is spotted, that really taking care of that early so that it doesn't develop into something worse. And then if something does happen, then and a root canal is needed, you can seek care from an endodontist to help to diagnose and treat that tooth pain.
Again, thank you so much for taking the time to chat with us and giving us all this great information.
Thank you so much.
Make sure that if you're having any tooth pain that you take the right steps moving forward. That way you can take care of your beautiful teeth and your wonderful smile. We're going to take a short break, and when we come back, we've got more of the show, so stay tuned.